This report is titled Hearing Detection and Intervention. Program connects deaf or hard of hearing infants and children to services, but actions needed to improve access. GAO looked into this program and found the Early Hearing Detection and Intervention, or EHDI program, is administered by the Department of Health and Human Services, HHS, which provides funding to programs in states and territories, such as Puerto Rico, to provide services. The EHDI program's purpose is to track the screening and diagnosis of infants for hearing loss and refer them to intervention services. Within HHS are the Health Resources and Services Administration, HRSA, and Centers for Disease Control and Prevention, CDC. CDC collects data, which HRSA uses to measure performance of EHDI programs across the U.S. Why did GAO do this work, and what was the approach? About 1 in every 500 infants is born with or develops hearing loss in early childhood. Getting early intervention services can help children meet milestones for language, speech, social, and emotional development. For example, if they receive appropriate services, deaf and hard of hearing children can develop language acquisition, which is the comprehension and use of language. HRSA provides grants to 59 states and territories, such as Puerto Rico, for this work. For the current grant cycle, HRSA awarded $235,000 per year to each state to support data tracking and referral efforts. HRSA also provides additional funding through competitive grants to state EHDI programs for specific purposes. A 2022 law, the Early Hearing Detection and Intervention Act, requires GAO to review the EHDI program. This report focuses on 5 areas. First, how HRSA measures EHDI program performance. Second, HRSA and CDC efforts to address state programs' reported challenges meeting EHDI benchmarks, program expectations related to detecting, diagnosing, and providing services. Third, what HRSA and CDC have done to support state efforts to improve language acquisition and any challenges states may face in improving language acquisition. Fourth, it examines HHS actions to identify and address disparities in access to EHDI program services. Fifth, it describes HRSA's efforts to help ensure support is available to parents of children with a hearing loss diagnosis. HRSA and CDC use 1-3-6 benchmarks, i.e. program expectations, to measure EHDI program performance on a national level. These benchmarks expect state programs to do 3 things. 1, before 1 month old, all infants should be screened for hearing loss. 3, before 3 months old, if an infant is identified as deaf or hard of hearing, they should see a specialist to diagnose and identify the cause of hearing loss. 6, before 6 months old, these infants should be enrolled in early intervention services to support communication skills. Starting with 2021 data, HRSA and CDC agreed to change how they measure state EHDI program progress against the 1-3-6 benchmarks. Previously, HRSA used a measure that did not count all infants who were eligible for follow-up care, but who the state couldn't confirm received that care. HRSA officials said they plan to use a different measure to assess state performance. This measure includes more infants with possible hearing loss as they progress through diagnostic and intervention services. Use of this measure will start with the 2024-2029 grant cycle. Officials said they know the new measure will show a lower percentage of infants receiving timely access to services, but they agree it will more accurately measure access. HRSA and CDC have taken steps to help address state challenges meeting EHDI benchmarks. For example, a 2023 survey found that there are shortages in experienced pediatric audiologists. In 5 of the states we interviewed, we found the same issue: not enough pediatric audiologists. That shortage makes it difficult to get timely diagnosis of hearing loss. HHS is helping states address this challenge by directing its technical assistance centers to focus on promising practices, such as telehealth, to connect with audiologists virtually. Regarding language acquisition, HRSA set a new program requirement in fiscal year 2024 for state EHDI programs to measure language acquisition outcomes. That is, developing the comprehension and use of language. HHS, to help states collect and measure language acquisition outcomes, conducted a pilot program and provided additional funding to strengthen state infrastructure to collect data about outcomes. Also, for challenges that states tell HRSA about, HHS has efforts to address these challenges, including providing technical assistance to help states collect more data. HRSA and CDC have done various things to improve how the EHDI program identifies and addresses disparities in access to services for deaf and hard of hearing children. Disparities means groups with different ethnicities or economic resources experience different levels of access to EHDI services. In 2021, HRSA required state EHDI programs to submit diversity and inclusion plans. These plans should clearly identify and address disparities in EHDI service access. However, GAO found that HRSA did not require states to set performance goals in these plans. This means HRSA cannot determine whether each state EHDI program is succeeding in addressing disparities in access. GAO also found that HRSA gets diversity and inclusion plans from the states, but did not assess the results to understand how states could update or use their plans to improve how they address disparities during the 2024 to 2029 funding cycle. If HRSA requires state programs to set and report on performance goals in the plans they give HRSA, states can more clearly show their progress in reducing disparities for underserved populations. If HRSA analyzes states' progress, it can plan better to support these programs. This will better ensure deaf and hard of hearing children in underserved populations get equal access to services. State EHDI programs have various efforts to support families to meet HRSA's requirements. Those efforts include 3. 1. Parent-to-parent support, in which trained parents of deaf and hard of hearing children provide support to new parents of deaf and hard of hearing children. 2. Deaf adult mentors, who can help parents better understand what their deaf or hard of hearing child's life experience might be like. 3. Automatic referrals for families with children who were recently diagnosed with hearing loss to connect them to family support services. The goal of this is to eliminate barriers for families to participate in the program and get services. For the issues GAO identified related to HRSA and disparities in access, GAO is making 2 recommendations to HRSA. First, related to performance goals, HRSA should require state EHDI programs to set performance goals and include them in their diversity and inclusion plans. These goals can be used to measure progress in addressing disparities in access for underserved populations. Second, related to data analysis, HRSA should assess the results of state EHDI program performance in addressing disparities in access and use that information to adjust future plans. GAO used this approach for its review. GAO analyzed HHS documents and data from 2008 through 2021. 2008 because it was the first year almost all states reported the same data. 2021 because it was the most recent available data. GAO interviewed HHS officials and 6 state EHDI program grantees. The states were chosen to vary by geography and whether they got additional funding for data collection. The 6 states were Alaska, Connecticut, Georgia, Minnesota, Ohio, and Puerto Rico. GAO reviewed documents and interviewed officials from the Department of Education about their interactions with the EHDI program, and how, at the state level, state EHDI program offices and offices that receive funds from the Department of Education and administer early intervention programs share data. GAO reviewed diversity and inclusion plans from all 59 states' EHDI program offices. Also, GAO interviewed 4 technical assistance centers that HRSA funded in the last 2 grant cycles. GAO also interviewed 3 advocacy organizations: NAD, the National Association of the Deaf, A.G. Bell Association, and ASDC, American Society for Deaf Children.